Well, let's talk about best do something instead of nothing. And we go back to the 27th when you look at her and say she has an ulcer. You determined that the best course of treatment at that point would be that you cut out a portion of this ulcer and send it to the lab so that you would know if there was an
cut off
infection.
some devitalized tissue and sent it to the lab.
Right. So you made the decision that she would be in better shape if you cut some devitalized tissue off than if you left it alone?
I had to establish a diagnosis.
And if you were going to establish a diagnosis, wouldn't that mean that you were considering continuing with treatment or at least making sure that treatment did continue?
And that's why I said to her at the time that this has to be followed up with Dr. Prakash.
And at the time being when?
I think it was the end of, the last time I think I talked to her was the end of March, early April.
But you talked to her at the beginning of March. At that time, why didn't you go see her? When you already had lab reports that showed...
Because she had to be on, I wanted her to be on 2 weeks of antibiotics.
Before you saw her to see how you thought?
I don't know that going to see her would have made any difference.
Well, you don't know that it wouldn't.
I don't know that it wouldn't, but...
when you asked Mrs. Weiss how she was doing, she said she's not doing well, she's not doing better, it's worse, right?
Objection.
Well, let me ask you what Mrs. Weiss
I don't
said.
think she said it was worse. I don't remember her saying it was worse. She said there didn't seem to be any improvement.
Now, was that enough to make you go see her?
Was what enough?
That she wasn't
That
getting
there wasn't
any better?
any improvement. No, because I don't know that I could have done anything of substance based on the fact that, you know, her circulation wasn't all that good. At the time, I didn't know, you know, what else, you know. I think I said to the aide at one time something to the effect that, you know, if we could put a wound gel on there, if you want, but that would require visiting nurses to come in. I think that was on the day of the visit.
You you are talking about her circulation throughout your records. As of the first time that you saw her, what was her circulation status?
Not good.
And when was the first time you saw her?
Well, I think it's a matter of record when the first time I saw her.
Okay. So if you go back to 13105, what do you know at that time about her vascular status?
That it's not very good.
It says absent.
Based on the pulses that I took and the overall, you know, condition of the feet.
What's
wasn't
DP
that
and
great.
PT?
Dorsalis pedis and posterior tibial pulses.
So she didn't have any of that in her right
They
foot.
were they were absent to diminished. I think I put down DP pulse equals +1 left at that visit.
Where's that?
Under vascular,
It says absent DP PT.
right foot.
Right foot. Where do you have
DP
+1?
pulse equals +1 left.
Okay, so you're talking about the left foot. Okay. The right foot has no pulses. What's that mean?
It means that the circulation's not very good.
So what does that mean as far as healing?
Not very good.
What did you do with this diagnosis that you had to have?
I put her on an antibiotic,
For how long?
2 weeks,
What dose?
500 milligrams, BID.
And is that what you think the standard of care is for the infection that she had?
Yes,
2 weeks?
yes.
And what did you do as far as follow-up? Because you were giving her antibiotics for a known infection. What did you do as far as follow-up?
Object to the form, you can answer.
I told Mrs. Weiss that I was going out of business and that she should, I had every expectation that she would follow up with Dr. Prakash, who had assumed my patient list at that time.
Okay, at what time? At what time?
He assumed my patient list as of 3/20.
3:20, but you talked to Mrs. Weiss as of 3/6.
Well, objection.
That was before she was on any antibiotics.
Okay, and as of 3/6, when you talked to Mrs. Weiss, you still had 2 more months that you were seeing patients. Why didn't you see this patient again?
Because I had every expectation she would go and she would see. I was going out of business.
But you hadn't gone out of business. And you performed a procedure without consent
Objection.
on this woman.
Argumentative. Objection. Argumentative.
Why didn't you go see her?
Had she made the recommendation that if she had requested that I go see her, I would have felt obligated to do so. She didn't make that recommendation, or she didn't ask me to see her mother.
So,
But I had every expectation she would see Dr. Prakash.
and then,
I'm leaving practice.
then what? What's Dr. Prakash going to do?
He's going to observe the progress of the toe, and if there's a lack thereof, I would presume he would have done what I did, and he would have referred her to a wound care center that does these types of problems all the time.
And this is a wound that you created.
Objection.
This is not a wound that I created. This is a wound I was trying to help.
All right, so your testimony is that that wound existed in an open fashion on her body prior to the time that you did this procedure.
That's correct.